reading a research paper together. The title of this paper is The Effects of Remote Ischemic Conditioning, RIC, on Patients with Acute Stroke. Hello, everyone. Today, we're going to discuss a very special study about the effects of remote ischemic conditioning, RIC, on patients who have suffered an acute stroke. It might sound a bit technical, but don't worry. I'll explain it in simple terms so everyone can understand. 1. What is remote ischemic conditioning, RIC? Imagine wrapping a blood pressure cuff around your arm, inflating it to temporarily block blood flow, then releasing it after 5 minutes. This cycle of repeatedly blocking and then restoring blood flow is what we call remote ischemic conditioning. 1. What is remote ischemic conditioning, RIC? Imagine wrapping a blood pressure cuff around your arm, inflating it to temporarily block blood flow, then releasing it after 5 minutes. This cycle of repeatedly blocking and then restoring blood flow is what we call remote ischemic conditioning. Research has found that this process doesn't just affect the arm. It may also protect other organs in the body, such as the brain. In simple terms, it's like training the body with brief, controlled episodes of reduced blood flow to help it better withstand a real stroke. Purpose of the study. This study is called the RESIST trial. The researchers wanted to find out whether RIC helps patients with different types of acute stroke. Specifically, they aim to see if certain stroke types benefit more from this treatment. How was the study conducted? Participants: patients aged 18 or older who showed stroke symptoms within the last 4 hours. Grouping: participants were randomly assigned to 2 groups. One received RIC, and the other received a sham RIC. The cuff was inflated to a low pressure that didn't actually block blood flow. Treatment procedure: each session involved 5 cycles of 5 minutes of cuff inflation followed by 5 minutes of deflation. Treatment timing: the treatment started in the ambulance or helicopter and continued after arrival at the hospital, with some patients receiving it for up to 7 days. Outcome measurement: the main measure was patients' functional recovery 90 days later, assessed using the modified Rankin scale, MISS, where a lower score indicates better ability to live independently. Research results: a total of 698 patients with acute ischemic stroke participated in the study. The findings showed that patients with small vessel disease, SVD, stroke who adhered well to the treatment, completing at least 80% of the cycles, demonstrated significantly better functional recovery at 90 days. Their chances of recovery were approximately 2.5 times higher than the control group, and even increased to 3.6 times after adjusting for other factors. However, for other stroke types, large artery atherosclerosis, LA, cardioembolic stroke, and strokes of unknown or multiple causes, no significant benefits were observed. In other words, remote ischemic conditioning, RIC, does not appear to help all stroke patients, but shows more noticeable effects in those with small vessel disease stroke. Significance of the study. What does this mean? RIC is a simple, non-invasive method where patients just need to apply a blood pressure cuff. It may genuinely aid recovery in patients with small vessel disease stroke. However, since this is a post-hoc analysis with a relatively small sample size, definitive conclusions cannot yet be drawn. The research team emphasizes that these results only provide a direction, and larger-scale clinical trials are needed to confirm the findings. Why might small vessel disease stroke benefit? The study speculates that RIC may help small vessel disease stroke through mechanisms such as reducing inflammation, promoting angiogenesis, growth of new small blood vessels, and increasing nitric oxide release to improve blood flow. These effects are particularly beneficial for small vessel disease stroke. Summary: RIC involves repeatedly inflating and deflating a blood pressure cuff on the arm to temporarily restrict blood flow. Overall, its effect in acute ischemic stroke patients is unclear. However, in patients with small vessel disease stroke who adhere well to the treatment, functional recovery at 90 days appears better. This finding is intriguing but requires further research for confirmation. Does everyone understand this paper? Does everyone like it? Do you believe in the effectiveness of RIC? Would you like to try RIC and take care of your health? Hurry and scan the QR code to order an RIC sphygmomanometer. Remember to scan the QR code to place your order. Thank you all for watching. I am Dr. Andrew Shu Lee. See you next time.